In this lecture, we'll be discussing provider wellness. An EMS practitioner's job is to be dedicated to providing the best pre-hospital emergency care that they can to the sick and injured patients that they come into contact with throughout their day. In order to do that, you can't lose sight on your most important asset, your personal wealth and safety, and how you protect that both on and off the scene. Throughout this lecture, we're going to discuss some possible safety issues, whether that's scene hazards, environmental conditions you might come into contact with, the human-made threats and violence that we see against first responders, infectious diseases that you may come into contact with throughout your day-to-day operations, and how to make sure that you're not compromising your safety. Past that, though, we also need to worry about your mental and emotional well-being and how you're going to cope with the things that you're going to witness and deal with while on this job. As new providers or providers who are leveling up, you need to be aware of your own health and your well-being, how you're going to maintain that and ensure that you know your limitations so that you don't end up in a compromised position where you're not able to render care, or worse, where you're putting yourself in an unsafe situation. For us, we should never think that the scene is safe. You should never let your guard down. Always ensure that you're maintaining safety for yourself, and that will maintain safety for your patients. Some recent studies done in 2013, it's the injuries and fatalities among emergency medical technicians and paramedics in the United States. They found that EMS actually has the lowest overall fatality rates compared to other emergency services for on-duty injuries or incidents. Law enforcement and fire services do have higher fatality rates while on the job. However, for non-fatal injuries, EMS exceeds all other facets of emergency professionals. This can be from strains and sprains and other common injuries that we see on the job from using unsafe practices or overworking or overexerting ourselves. Fatigue and sleep deprivation are also major contributing factors to why EMS has higher non-fatal injuries. We're pushing ourselves to the limit. All of our jobs are demanding, and you guys are seeing this in the field, that you often are putting yourself in unsafe situations, which in turn is putting your patients in unsafe situations. Data from the National Highway Traffic Safety Administration suggests that as many as 1,500 ambulance crashes occur in the United States each year. 59% of those occur during emergency response, and the other 34 are non-emergent. So we can see that driving emergent, and again, putting ourselves in those unsafe situations, leads to increased incidents for us. We'll get more to that in just a little bit, but first let's talk about the different components of well-being. How, before you're even responding to the call, you can make sure that you're protecting yourself or setting yourself up for success. When we think of wellness, you think of overall good health. You're thriving, you're living your best possible life. But wellness really breaks down for more than just the physical. There's the physical aspect, but there's also the mental and emotional. Some people believe that spiritual wellness is also essential, and that's going to bundle in with your mental and your emotional. For the physical aspect, providers should be in relatively good physical shape. This is going to allow you to do the requirements of your job and limit the number of injuries that you may have. We can see that you're less likely to become injured and ill whenever you're physically in shape, so having a good physical activity routine will improve your cardiovascular health as well as your overall skeletal muscle, which will lead to you having less on-the-job injuries because your body is already kind of in that peak or at least near peak condition and state whenever you're getting on the scene and you're doing the requirements of the job. If you are injured, you may heal more quickly whenever you do have good physical strength as well as have a good nutritional basis. And I know that working in EMS, rarely do we have good eating habits because you're just trying to eat whatever you can possibly get during the day because you're trying to normally scarf it down between calls. However, trying to make sure that whatever you're scarfing down is at least the fuel that your body needs and it's good nourishment will only benefit you later on. And it'll give you a better quality of life. Again, you're less likely to get injured and ill, which means you're more likely to be able to maintain a healthy work relationship, and less time out of work will lead to you being able to provide and flourish and keep paying the bills, honestly. The American Heart Association does have 7 simple, they say, factors that improve your heart health. First of all, get active. Get out there It doesn't have to be running a marathon. It can just be 30 minutes of walking a day. Ensuring that you're building up. Your heart is also a muscle, and we need to make sure that we're giving it the exercise that it needs. So some good aerobic and anaerobic exercises. Eating foods that are lower in cholesterol will improve our overall cardiovascular health, but also limit the likelihood that we're going to have some type of coronary event. People who work in emergency services, EMS and fire, have increased risks of heart attack whenever we're on shift. And it's because of that sudden adrenaline rush and that sudden dump of all the cortisol whenever you instantly are snapped into fight or flight, whenever the tones go off, especially if it's in the middle of the night and it happens to wake you up because you were getting those couple minutes of sleep you desperately needed. Having that lower cholesterol diet will ensure that whenever you do have one of those incidents or you do have a call that comes out, your heart and your entire cardiovascular system is in the best possible shape it can be. Eating better. It doesn't have to always be a salad like you see on the screen, but trying to make sure that the food you're putting into your body is nourishing you and it's feeding you. All food is fuel. So you want to give your body the best fuel you can, making sure that you're eating good lean proteins, that you're limiting the amount of processed foods that you're having, that the foods that you're consuming are also high in fiber. We want to make sure that we have good fiber. That lowers your risk of colon cancer as well. We need to manage our blood pressure again. Those sudden dumps in your fight or flight and going into the sympathetic system constantly whenever we're on calls. That's going to increase your blood pressure. So we want to make sure that before that happens, that we're not already having hypertensive issues. If you are overweight, trying to manage your weight is going to be important as well. This is not only for your overall heart health and the response to call, but the stress that it's putting on your body. When you are carrying excess weight and then you're lifting a bunch of excess weight, whenever you're trying to help your patients, it's a lot of strain on your joints, which can lead to injuries. Stopping smoking. Everybody has a vice in EMS. Smoking really is bad for your health overall. Not only the implications it has on your pulmonary system, but it increases your risk of blood clots. It also can lead to cancers outside of your pulmonary system. So trying to manage our bad habits that we use to cope with the job and find other healthier ways is going to be important. Nutrition. We all know and love the nutrition table that we'll see on the next slide, which are going to be the current nutritional guidelines. When we have poor nutrition, it can lead to heart disease, type 2 diabetes, obesity. That obesity will then lead to other conditions that we can see, like hyperlipidemia, increased risk of injuries, renal disease. It's just a slippery slope. So trying to maintain and eat a good nutritional basis. Again, hitting all the main categories of foods within the portions that we want to see them in so that you're feeding your body like you should. We can go to myplate.gov, which again, we'll see that on the next slide, we'll have a graphic, but we want good fruits, veggies, grains, dairy, protein foods, oils. When we're eating oils and fats, we want to make sure they're healthier oils and fats as best we can. Same old plate we saw. So we want to limit the number of things that we know are going to be less nutrient dense. So we want to have lots of vegetables, fruits, grains, things that are going to be nutrient dense and really feed our body. And when we're looking at what to eat of each of these things, we also want to make sure that we're eating things that are as little processed as possible. So the closer it is to how it comes out of the field or once it's freshly been slaughtered is going to be closer to how we'd like to try to eat it as best we can. Again, I know working in our field, this is near impossible to do. Just making a concerted effort. Prepared foods are less of an issue. Processed foods are more. So if you're getting some food that is being meal prepped for you by a company, which honestly is a good fit if you can afford it when you work in our field, because it's keeping you from having the dreaded gas station hot dog. Processed foods are going to be more of the issue. So things that have abnormally high sodium levels. So processed foods can reach up to 50% of your daily allowance of sodium in just one serving. And we all know you're not eating just one serving of whatever it is. You're probably eating a couple. because that's what it's going to take to fill you up to keep fueling you for the rest of the day. So we need to be careful about things like that. And again, the amounts and the types of fat. We want to have a lower cholesterol diet, which is going to decrease our risk of cardiac events that we could possibly have. And when we're looking at our carbohydrates, we want to make sure that they are as complex as we can get them. So rather than eat simple sugars, we want to eat something like a pasta or a bread, something that's going to have those more complex carbohydrates that's going to take our body longer to break down, and it's going to give us more fuel for longer. It's also increasing the amount of fiber that we're having when we do that. Beware of fat-free products. They tend to substitute those fats for things that are less gentle on your systems. They can also cause, if it's enough to scare you, anal leakage. You do not want that, especially when you're working on the truck. And we really want to look for those higher fiber contents. It's better for your overall colorectal health. And again, higher fiber diets not only are higher in satiety, so keeping you nice and full, but it also will decrease your risk of cancers like colorectal cancer down the line. If you know you're working for somewhere where you're not going to get to cook a meal, or you're not joined with like a fire station where they're going to be nice and provide food for you, try to set yourself up for success when you're going in for your shift, where even if you only have a little amount of time, you're able to capitalize on that with eating a good meal. So prepping your meals, knowing what to bring with you. So bringing lots of water with you, various types of healthy snacks or snack bars if you're able to, different types of fruit that are easy to grab and eat. Same with vegetables. Avoid candy bars, things with drinks with excess amounts of caffeine and energy drinks. I know we all sustain ourselves on those, especially when you're starting for those early morning shifts or you're coming in for the night shift and you know you're going to be running all night. However, those are hell on your system, especially your cardiovascular system. And when we already know we're stressing our cardiovascular system working in this field, adding that extra caffeine really doesn't help. I'm not going to harp on you guys super bad about weight. I'm sure if you are in the category, I am myself, where you need to be concerned about where your weight is, somebody else is already telling it to you. However, just from this mindset in our field, when we're carrying excess weight, it does lead to increased incidence of injuries. Back injuries are going to be the big one, and then knee, hip, ankle injuries. So by trying to get yourself into a healthier weight group, whether that's exercise, diet, talking to your doctor to see what else you can do to try to lower your weight, it lowers your risk of injury, but then also it lowers your risk of having cardiac events while you're at work. Please do not do anything like crash diets. Things that are sustainable shifts are going to be what ultimately helps you. Regular exercise, one, helps with body weight, gets you into a more healthy weight zone. It gets you into a better body composition for muscle to fat to height ratio. It can help improve your nutritional status. You can eat a couple of the extra things you're maybe wanting to eat because you're going to burn it off whenever you're exercising. Increased hydration also helps whenever we're exercising and whenever we're at work. We need water. If you are urinating and it is anything other than a pale yellow, you have not had enough water to drink. And all of us are chronically dehydrated, and then we fuss at our patients about it, but we need to be better about it as well. Find an exercise program that works for you. If you do not like running, don't run. Find other ways that you can exercise and improve your cardiovascular health. Weight training, it does not have to be to get big and bulk and buff, but doing some level of weight training also is very beneficial for our jobs. The more muscle you have that can be protective around your joints, the less likely you are to cause injury whenever you're in the field working. Already kind of started hitting on this, but the exercise programs you're looking at should be one, cardiovascular endurance. So doing good anaerobic exercise, improving your cardiovascular health, making sure that your heart is an optimal pump so that you're able to adjust to those spikes in cortisol and adrenaline throughout the day whenever we're going on those calls or we're on a call with a patient. Goal should be maybe to be able to do compressions without getting out of breath. That is a simple goal, but it shows that you've at least gotten some good cardiovascular endurance going on. Doing overall physical strength, so doing some type of strength training, and then flexibility. being able to bend and move and meet the needs of our jobs without the risk of injury. So helping the patient up, picking up the stretcher, carrying the bags. These are all things that we can improve or make easier by having good physical health. If you're unsure where to start, find somebody at work that looks like they're physically fit. There are also great programs out there that are geared towards first responders and how to ensure that you are able to do exercises that'll benefit you in the long run while you're on the job, especially if you're somebody who doesn't like exercising. Looking into one of those might be beneficial. Good body mechanics should be a part of our physical fitness that we're looking for. And so incorporating that with exercise. But for us, it's going to be about how we're operating on the job. You have to have good body mechanics in order to lift and move the patients without causing harm to yourself. This is where us as providers hurt ourselves the most, is poor body mechanics. And I know people fall in the most awkward positions, like the Bermuda Triangle of the bathroom, that sacred spot that's between the toilet and the tub where they get wedged in there. And there's no way you can use good body mechanics to possibly move that patient. But we need to try as best we can. Making sure that you have the full amount of resources on scene whenever you're going to lift a patient. So if you're going to need fire or an extra unit to give you extra hands because the patient exceeds the weight that you and your partner can safely lift together, ask for them to come. If there are people on scene who could help you, ask for them to help you. Do not think you have to be Superman and lift that patient by yourself. That's how you hurt yourself and you end up with a very short career. Using good body mechanics, this picture here is excellent. So we want to bend with our knees, not our back. We want to keep our back nice and straight, tilted slightly forward with our waist as a fulcrum when we're leaning down. We want our arms to be extended. We want to use the biggest muscles that all of us carry, whether you're a man, whether you're a lady. Butt into legs is going to be the best muscle groups you can use when lifting heavy things. Always lift with your legs. You also want to make sure to keep breathing whenever you're lifting. If you lock out your elbows and you lock out your body like this, and then you hold your breath when you're coming up, you're more than likely going to vagal. As you vagal, you're going to pass out. So we want to avoid that, especially whenever we're lifting things on scene and when we're lifting patients. Our goal is to not hurt ourselves and not to hurt our patients. Another good habit is to not carry anything that you can put on wheels. If you can set it on the stretcher, if you can utilize the stair chair, please do that. There's no shame in putting something on the wheeled apparatus, setting your bags on the stretcher, setting your monitor on the stretcher, things that you can limit the time that you're carrying it. If you have to bring that with you already, go ahead and do that. Most of our injuries aren't from that one big lift. It's from the continual strain on our body. So that continual strain, even though it's only 8-10 pounds, you're carrying that 8-10 pounds repeatedly throughout the day. If you can put it on something that's going to be wheeled and pulled with you, do that instead. And again, please ask for help if it exceeds what you can comfortably lift. Talked about it earlier. I don't want to beat the dead horse. Smoking and tobacco have been proven time and time again through lengthy amounts of research to not be safe. So if you're not a smoker, you're not somebody who already utilized tobacco, you can ignore this message, zone out for the next couple minutes. If you are, please consider looking at some type of smoking cessation. Switching to tobacco-less products at first, and then seeing how you can start weaning yourself off of even those. Vaping, just as bad as smoking. In the long run, it's better short term if that's going to be what helps you ultimately quit. But it's still not good for your lungs. Alcohol use. This can be a slippery slope. If you are under 21, please don't drink. Please don't start drinking until you are of legal age. If you're over 21, you are legally allowed to use alcohol, and there's absolutely no problem with imbibing as long as you're not using it as a crutch. Where alcohol becomes an issue is when we're using it as our coping mechanism to the things that we're dealing with. And once you start using it as a coping mechanism, it's now no longer a safe thing to be doing. It is now creeping towards addiction. We really don't want to start going down that route if we can help it. So trying to make sure that you're not doing things like imbibing or drinking to the point that you are blacking out frequently. Drinking alone is kind of one of the big red flags. And I don't mean you come home from work and you're home all alone, or you live alone and so there's really no one else and you come home and you want to have a drink. That's fine. But if you are drinking heavily, or you're hiding from those who care about you to drink the amount that you are, it might be time to reach out for help instead of using this as your coping mechanism for dealing with the stressors of the job. Circadian rhythms in our shift work. EMS and really all types of public safety, but uniquely EMS, it is like the constant fight with your body's natural mechanisms. Your circadian rhythm is your natural awake sleep cycle. It's hormonally driven. It has a lot to do with cortisol and melatonin within your body. And it's what makes you start getting sleepy as night goes on. And then as the morning comes, you start to slowly, gradually start to wake up. EMS absolutely throws that out the window, whether you're somebody who works night shift or whether you're somebody who works some type of 24/48 insert your shift schedule. You are constantly being awoken when your body is trying to tell you that you need to sleep. And the problem is that the more you do that, the more you can, one, throw off your body's ability to get good sleep, but two, you increase your risk for cardiovascular diseases because you're dumping lots of cortisol in order to maintain that awakeness. You cannot overlook your need for sleep enough. So we need, knowing that we can't change certain things, right? You can't change if you are a night shift. You can't change if you're 24/48 and when a call comes in. So you need to try to adjust to it. One, if you're night shift, be prepared to fully live a night shift life. I know that gets hard because adult things happen during the day, right? That's whenever most businesses are open that you're going to need to utilize. That's when doctor's offices, if you need to go make a visit. So there's some things you're not going to be able to avoid during the day. However, trying to be awake and do daytime activities on your days off and then switch to only being up during the night during your night shifts is not going to be sustainable long term. So do things like invest in blackout curtains. Make sure that the other people that live with you know that you need to be able to sleep during the day because your awake time is going to be at night. You're going to shift to that night owl persona. You can also try to determine when your natural rhythms are. Some people are more awake at night. They are those night owls. And if that's you, see if you can get on that schedule if it best suits you. If you are doing shift work on night shift or on one of those 24 plus hour shifts, you need to try to avoid caffeine as best you can whenever nighttime hits, especially when you're off shift, to allow your body's natural circadian rhythm to start kicking back in. Eating healthy meals, and trying to find any way that you can get as much sleep as you possibly can. The reason is that people who are not even tired, it's past tired. If your body is devoid of sleep and you need and you're at like the point of truly inadequate sleep, it has the same effect on your mind and your body as being severely intoxicated does. And that can be a huge issue when you're operating an ambulance or whenever you're supposed to be making split decisions for your patient that could be a life or death decision for them. So trying to ensure that when you can get sleep, you're getting adequate and you're getting good sleep is very important. The last thing we're going to talk about during this particular lecture is going for your health risk assessments. Please go to a primary care doctor. Even if you're young, it is never too early to start going to a primary care doctor and getting baselines established. If you work for a service that does yearly physicals, awesome. I wish every public service department did yearly physicals. And not just like a physical agility or physical fitness assessment, but lab work, body scans. Most fire departments do a really good job with this, making sure that their employees are in adequate physical shape to be able to do the job. EMS suffers on this a little bit most of the time. I wish we didn't. If you're not going to do it with your department doesn't do it, you should do it. Especially if you have family history. You have family history of diabetes, of high cholesterol, of early cardiac disease. In another presentation, we're going to talk about mental aspect of provider wellness and provider well-being. If you have family history of mental illness, that's something that you need to be cognizant of and you need to be following up on when you're looking at these risk assessments for your health. I hope you enjoyed this presentation. If you have any questions, please reach out to your instructor.